On today's practical, I'm going to discuss about AST or antimicrobial susceptibility testing. So here, why do we perform this test, or what is the purpose, what is the reason behind? So this microbial susceptibility testing is done once the causative organism of a specific disease in a patient has been isolated. It is up to the attending physician to administer a chemotherapeutic agent that will inhibit or kill the pathogen without causing serious harm to the individual. Then the method must be relatively simple to use, be very reliable, and yield results in as short time as possible. So we have different methods where we can perform this AST, but today I'm going to discuss mostly about the Kirby-Boer method. So the Kirby-Boer method of sensitivity testing is such a method used for testing both antibiotics and drugs. Antibiotics are the chemotherapeutic agents of low molecular weight produced by microorganisms that inhibit or kill other microorganisms. Here, drugs on the other hand are antimicrobic agents that are man-made. So the effectiveness of an antimicrobic in sensitivity testing is based on the size of the zone of inhibition that surrounds a disc. If you see the picture, we have those small white color, those are the disc. Okay, so they are based on the zone of inhibition that surrounds a disc that has been impregnated with a specific concentration of the agent. Then the zone of inhibition, however, varies with the diffusibility of the agent, the size of the inoculum, the type of medium, and many other factors. And only by taking all these variables into consideration can be reliable method to work out. So the Kirby-Boer method, it is a standardized system that takes all variables into consideration. So the recommended medium in this test is MHA or Mueller-Hinton agar. So its pH should be between 7.2 and 7.4, and it should be poured to a uniform thickness of 4 mm in the Petri plate or Petri dish. This requires 60 ml in case if we are using 150 mm plate and 25 ml in a 100 mm plate. So different amount varies in different size of the plates. Okay. So for certain fastidious microorganisms, 5% defibrinated sheep blood is added to the medium. So it depends on the microorganism, right? So the inoculation of the surface of the medium is made with a cotton swab from a broth culture. In clinical in clinical applications, the broth turbidity has to match a defined standard. We usually call it a Macfarlane standard, and also care must be taken to express excess broth from the swab prior to inoculation. Then high potency discs are used that may be placed on the agar with a mechanical dispenser or with the help of forceps, sterile forceps. So to secure the disc to the medium, it is necessary to press them down onto the agar. Later we will discuss the steps or the procedure properly. Then after 16 to 18 hours of incubation, the plates are examined and the diameters of the zones are measured to the nearest millimeter. Okay, so that's for AST. What are the things we need to know? Then coming to the introduction, out here the pathogenic bacteria exhibit great strain variations in susceptibility to antibiotics. So it is therefore very important or essential to determine the susceptibility of isolates to antibiotics that are likely to be used in the treatment of patients. So we should guide the clinicians in choosing the right antibiotic for a particular infection. Then this AST also helps in identifying the susceptibility patterns of common isolates in a particular hospital or a community. So we have, like I said earlier, different types of AST, antimicrobial sensitivity testing. Out here we have two different types, that includes diffusion test and dilution test. So under diffusion test, it is again divided into a Stokes diffusion method and Carbibore disc diffusion method. So these two methods comes under diffusion test. Then in dilution test we have broth dilution method and agar dilution method. But in today's practical, mostly I'm going to discuss is the Carbibore disc diffusion method. Okay, so I'm just going to show the picture for other diffusion tests, like for Stokes disc diffusion method and modified Stokes disc diffusion method. This is how we performed, and the Carbibore on the other side. Then we have the dilution test, both the broth dilution method and the agar dilution method. The broth dilution method, because they are in a liquid form, it will be carried out in a test tube, whereas the agar dilution method, which are in a solid form, they can be done in a plate or petri plates. So let's move on with the Carbibore disc diffusion method. This method, it is very simple, reliable. It can be used widely in most of the lab. Okay, so we need to know some important points or terms like MIC and MBC. What is this MIC? MIC is the minimum inhibitory concentration and MBC is the minimum bactericidal concentration. So MIC, it is the lowest concentration of an antimicrobial agent that visibly inhibits the growth of the organism, whereas MBC, it is the lowest concentration of an antimicrobial agent that results in the death of the organism. So what is the uses of determination of MIC? So the uses includes like when the therapeutic dose is to be regulated accurately, as in the treatment of bacterial endocarditis, and another use is for testing antimicrobial sensitivities of low growing bacteria such as tubercle bacilli. Then another use is when small degrees of resistance are to be demonstrated. So these are the few uses of MIC. So before we proceed with the steps or the procedure of Carbibore disc diffusion method, we need to prepare or get ready with the materials required. So one of the materials required here is the McFarland standard. So how do we prepare this McFarland standard? So this McFarland standards are used to standardize the approximate number of bacteria in a liquid suspension by comparing the turbidity of the test suspension with that of the McFarland standard. And this McFarland standard is a chemical solution made up of that consists of barium chloride and sulfuric acid. So the reaction between these two chemicals will result in the production of a fine precipitate barium sulfate. Then how do we prepare this McFarland standard? So we will mix the McFarland standard on a vortex mixture prior to examination or before we perform the test. Then we need to ensure that the McFarland standard is aliquoted into a tube that is the same size and diameter as the tube used to prepare the test suspension or the bacterial suspension. Then prepare a test suspension by obtaining a fresh pure culture of the test organism and inoculating a suitable broth. Then in the presence of good lighting, visually compare the turbidity of test suspension with that of the Macfarlane standard by comparing the clarity of the lines on the Wickham card. Then if the test suspension is too light, inoculate with additional organisms or incubate tube until turbidity matches that of the standard. And if dilution is necessary, we will use a sterile pipette and add sufficient broth or saline to obtain a turbidity that matches that of the standard. So this Macfarlane standard is one of the requirement or the material needed for this performing this Carbivore disc diffusion method. Then other materials we will need is like Petri plate of MHA or Muller-Hinton agar. Then we will need nutrient broth culture with swabs, then disc dispenser, cartridge of disc, forceps and Bunsen burner. Then we will need the chart, zone interpretation chart. Okay, so sorry, the steps we can carry on is we will dip a cotton into a cotton swab into the inoculum. Then we will inoculate it on the Muller-Hinton agar plate by sticking the swab 3 times over the entire agar surface. Then we will allow 3 to 5 minutes for the surface of agar to dry before we apply the antibiotic disc. We can use either sterile forceps or multi-disc dispenser for keeping the disc or applying the disc on the plate. Then on a plate that is 10 mm diameter, we can use 7 discs on this plate. One in the center and 6 in the periphery. Then after we kept all this required disc on the plate, we will incubate the plates at 37 degrees Celsius for 16 to 18 hours. Then the zone of complete growth inhibition around each of the discs are measured. So the interpretation of zone size into sensitive, intermediate or resistant is based on the chart. We have the interpretation chart given by CLSI guidelines. So the control strains we can use like strains of ATCC Staph aureus 25923. Another strain we have ATCC Escherichia coli 25922, ATCC Pseudomonas aeruginosa 27853, and some other strains as well we can use as the control strains. Then this should be tested each time when a new batch of disc or agar is used to make sure that we don't get any false positive results. Okay, so this is how we perform the Carbivore disc diffusion method, what I mentioned just now. Okay, then coming to the disc, antimicrobial disc. Here the choice of antimicrobials to be included in susceptibility test will depend on the pathogen, specimen, range of locally available antimicrobials, and it can be purchased commercially or prepared in-house. So that is how we can get the disc or antimicrobial disc. So that's all about AST or antimicrobial susceptibility testing. Thank you.